the diagrammatic presentation of its processing, collection of the apheresis from the patient's T-cell extraction, going to lab, preparing the CAR, and again grow the millions of CAR T cells which will be later infused on the patient's body. Its history started, National Institute of Health idea was developing for CAR T in early 1990s. Zelig Escher, Patrick Ho, and Steven Rosenberg. What if genetically engineered T cells to express a hybrid or chimeric receptor that can recognize cancer antigens independent from HLA antigen expression? It was a historical moment for the patient, the little baby we all know, Emily Whitehead, in 2012, who was 6 years old only that time, with relapsed acute lymphoblastic leukemia, failed months of unsuccessful chemotherapy, and ineligible for bone marrow transplant. She was enrolled in the first phase 1 CAR-T trial for ALL. That made her the first patient pediatric ever to receive the treatment and the first patient of any age to receive it for ALL. Till date, she is free of cancer, and she founded a foundation for helping her kind of patients. The major landmarks in CAR-T history, it started from 2017, the first CAR Exicel. It was approved by FDA for large B-cell lymphoma relapse refractory setting. In 2017, another agent, Tisacel, that's also approved for relapse refractory B-ALL cases. Subsequent year in 2018, Tisacel also got approval for large B-cell lymphoma in relapse refractory setting. In 20, Brexucel for relapse refractory mantle cell lymphoma. 2021 was a happening year. 4 agents got approval for different indications, including Exicel for relapse refractory follicular lymphoma, Lisocel for relapse refractory large B-cell lymphoma, Idacel was for myeloma in case of relapse refractory, and Brexucel for ALL relapse refractory. 2022, Exicel was approved for large B-cell lymphoma. Cilta-cel also for myeloma in 2022. The trials that give rise to approval of these agents and subsequent spanning these years from 2017 to 2024 are Tisacel, XC, Brexucel, Lisocel, Idacel, Cilta-cel, Obe-cel. The trial name I mentioned in the right column, Ilana trial, Julieta, Irara, Zuma 1, Zuma 2, Transcend, Karma, Gratitude 1, and Felix. They have different targets, particularly CD19, BCMA, covering these two. This diagram pie chart showing CIMB data according to record young adult diffuse large B-cell lymphoma and follicular, just to recapitulate. Exicel, DLBCL, transformed follicular lymphoma, primary mediastinal B-cell lymphoma, and high-grade B-cell lymphoma. Brexucel for mantle cell lymphoma and B-cell ALL for adult. Lisocel for follicular lymphoma, DLBCL, MCL, and CLL. Octazil Obe-cel for B-cell ALL, and Idacel Cilta-cel for multiple myeloma. Other than the hematological malignancies, there are 2 indicated FDA approval product CAR-T for lifileucel in metastatic melanoma and afamicidin autoleucel for metastatic synovial sarcoma. The major complications of we need to concern for CAR-T cell therapy is CRS, immune effector cell associated neurotoxicity syndrome, ICANS, cytopenia, and that could be pancytopenia, hypogammaglobulinemia, and subsequent infections. There are 2 criteria for CRS, UPenn grading and Lee criteria. According to them, the management of the care and goes to steroid, dexamethasone, and to interleukin-6 blockade. Grade 3 and grade 4 is the highest one, and the support is also combining in this format. And the management of ICANS, that's also go for as per grading, grade 1, 2, 3, 4, and this also include combination of steroids and blockade. The challenges in the establishment, as we all know, the financial constraint and other logistics supports for a country like Bangladesh and third world. Other than those, potential severe adverse events, cost of manufacturing, as I mentioned, accessibility to manufacturing process, and limited success in solid tumors till date. In future perspectives, engineering other immune cells, natural killer T cells, macrophages, neutrophils, these are underway in researches, has shown impressive responses in CAR NK cell therapy in human clinical trials. As I mentioned, I'm from Evercare Hospital, Dhaka. This is my team headed by Dr. Mohammad Abu Jafar Saleh. Thank you, BICC, Organizing Committee, and the audience for your patience hearing.
Thank you, Dr. Smita, for that inspiring talk on CAR-T therapy. A reminder that innovation is science is often the bridge between hope and healing. So our next speaker is Dr. Mafruha Akhtar, Associate Professor of Hematology at Haque Medical College. She will shed the light on the challenges of diagnosing and managing lymphoma in Bangladesh. As we all know, lymphoma care in resource-limited settings often demands innovation and resilience. So we are welcoming Dr. Mafruha Akhtar. She has received his post-fellowship training in bone marrow transplantation in various reputed institutes, including USA, Thailand, and India. And her special interests include in lymphoma, myeloma, BMT, and thalassemia. And she had pivotal role in bone marrow transplantation since its inception in Bangladesh in 2013. So let's welcome Associate Professor Dr. Mafruha Akhtar for her presentation.